Hey guys, Thomas Doty here. So recently we got a new kit for our Cric procedures. So what I'm going to do today is we're just going to bust this open. We're going to look at each piece of equipment. So after we've opened it, we're just going to pull this out. And I just kind of want to show you and walk through what piece of equipment that we have. So first and foremost, this is going to come with a 6.5 ET tube. This is going to come with our mask and splash guard visor. This is going to come with two 4x4s. I would recommend maybe grab a couple more. This is probably going to be a little bloody, and maybe even a towel. This is going to come with a scalpel. One thing I want to point out with the scalpel is it's not our traditional scalpel. This is not a retracting scalpel. This is just a capped scalpel. So keep that in mind for safety. It's also going to have a 12cc syringe. And this box here is going to have our tracheal hook in it. And this just appears to be just your standard tracheal hook. And we have a new securement device here. It appears to be pretty similar to our Thomas ET tube holders that we use for our ET tubes. But as you see here, this is a white strap. We're going to have white Velcro on this side, black Velcro on this side. And here's the hole that the tube is actually going to go in. As you see here, there are actual teeth on here. And after you place the tube and you go to push these teeth in, this will actually lock in place. Okay? So make sure you remember that once you insert these in, as you see here, this is locked and this is not coming out. So you're going to put this on just like you would your regular ET tube holder. And that white Velcro on this side is going to secure just as this. Okay. And then we have our standard forceps. One thing I noticed with these forceps, this does not have the clip or locking mechanism. You're going to spread it apart, or I'm sorry, you're going to close it in to open it. But again, it does not have the lock on it. And it's going to come with chlorhexidine. One really important thing I want to point out is this does not have our standard 18 gauge needle in here. Okay, this is something, if you have to use this procedure, you're going to have to pull this out of your IV tray, your needles tray, whatnot, and actually make sure that you have this to begin the procedure. Okay, so again, I just want to break this down for you, show kind of what we have before we actually use it. Okay, thank you. Okay, now we're actually going to go through the procedure. So I'm going to find my landmark. So there's a couple different methods that you can use to do this. What I'm going to be doing today is I'm going to pinch my Adam's apple or the thyroid cartilage, and I'm going to feel right underneath it. So I can feel here that I have my cricothyroid membrane. So I'm going to take my needle that is already attached to my syringe and I'm going to insert it in. So as we insert it in, we should have rapid aspiration of the syringe. This is going to confirm that we're actually in the trachea. After you have that aspiration of the air, we're going to stop. We're not going to advance it any further. And then after this, we're going to remove our syringe and we're going to apply our forceps to it. So make sure that you're applying your forceps upside down, as you see Chastity doing here. You can use a firefighter, your EMT, or whatnot to actually do this. So after we've done that, we're going to take and we're going to actually cut about an inch below and above with our scalpel here. Make sure we're not using a sawing technique here. We're simply just cutting through, trying to pierce. And then we're going to come in above as well. And we're going to use a blunt dissection technique to expose that cricothyroid membrane. And after this, we're going to go about a ½ inch horizontally. And after that, we should be done with our scalpel. Now we can remove our needle with our forceps. And then at this point, you can either blunt dissect with your finger and actually hold that cricothyroid membrane, or you could take your tracheal hook. So after we've removed our needle and our forceps, we're going to either take our finger to dilate to hold the place of the cricothyroid membrane, or we can take our J-hook or tracheal hook and place it in here, such as this. Then we could take our ET tube, and we're going to pass our ET tube into the trachea. One thing to remember is the second that this balloon is past the skin and into the trachea, we are done. Now we're going to remove our hook. We're going to take our securement device, and we're going to secure this. We're also going to use our standard conformation techniques. We're going to mark the number of where we're at on the skin, inflate our balloon, apply end-tidal capnography, colorimetric, auscultate lung sounds, and absent epigastric sounds to confirm they're actually in the placement. Okay. Document accordingly and notify your receiving hospital of what's been done. Thank you. Hey guys, real quick, I just want to go over real quick just about this securement device and actually how it operates. So just playing with it seems like having it facing up with the opening seems to be the easier way to approach with it. And then again, you could see these teeth right here. So we could take our teeth, and it's simply, after we place the ET tube in, it's simply just going to click in, and you can hear it here and lock. Okay, make sure we're not pinching the tube, but it's going to lock. And I'm going to try to open it, and as you can see, it's not actually opening it. If I want to release it, I can take this pull tab and press against it, and now I can release it. But it seems a fairly easy way to actually secure our tubes.